Hey, so May is Mental Health Awareness Month, and specifically it's Maternal Health Awareness Month. And we know how hard you moms work, and it is a difficult journey into motherhood, but it can be so joyful, of course. But we know that it comes with sleep deprivation, it comes with, worrying about your children. And one of the things that we try to do in our practice at Thrive-O Pediatrics and as a Thrive-O pediatrician is we try to make sure that we're acknowledging what's going on with mom and dads too. Dads can, struggle with mood disorders that come through having a new child, whether it be anxiety or worry and depression. And so what we know about maternal mental health specifically for moms is that about 30% of women go into a pregnancy already having some anxiety and some depression, and that can get significantly worse after the baby is born. And then another 20 to 30% of women after having had their babies will develop, some anxiety and depression or some sort of other mood disorder. So it's really important to make sure that you as your family and your partners are acknowledging all this, that you have providers, including your pediatricians, who are asking you about how your health is doing, especially your mental health. Mental health is a component of not only how you feel, mentally, but it's also a component of, physical health as well. There's certainly physical things like sleep deprivation, iron deprivation, anemia, which is the low iron, and other minerals and nutrients that, if they're deficient, can lead to mental health struggles. So this is really just a video just to acknowledge how difficult parenthood is, and specifically for moms, having had all the hormonal changes through having had a baby and getting pregnant, that we want to make sure that you are taken care of and that you're heard and that you're seen, and that your practitioners, whether it be your OB or your pediatricians, are asking you these questions. And there are some standard questionnaires that we can use called Edinburgh Depression Screen. It's called the EPDS, and it's intended to ferret out, concerns about anxiety and depression. So make sure that you're filling that out. It's just a really simple form, and your OBGYN and your pediatricians are hopefully asking you to fill out those forms. Sometimes, moms think that they're doing great, and then when you fill out this questionnaire, you realize that your scores are pretty high and that you're at risk, and then there's just a conversation to be had around that. There's no stigma attached to that. It is just the biological function of having had a baby and just getting through that. So we want to just acknowledge you moms for how hard you work and that you're seen and that you're heard.